Shri Dinesh Gundu Rao.
Side. Sir.
New technologies in medical field. Last year there are more than 750 students who got medical seat across the India, 2 into AIMS Delhi also. So I used to ask, sir, what exactly interventional radiology mean? I don't know. Radiology ಗೊತ್ತು, intervention ಅನ್ನೋದು ಇಷ್ಟು ಟೆಕ್ನಾಲಜಿ ಇದೆಯಂತ. ಸೊ ಇದಿದ್ದಾಗ ಲೈಫ್ ಸ್ಪ್ಯಾನ್ ಜಾಸ್ತಿ ಆಗುತ್ತೆ, ಈ ಭಾಗದ ಜನಕ್ಕೂ ಅನುಕೂಲ ಆಗುತ್ತೆ. ನಮ್ಮ ಗ್ಲೆನೆಂಜಿಯಲ್ ಗ್ರೂಪ್ಗೆ ಲಾಸ್ಟ್ 2 months ಬ್ಯಾಕ್ ಐ ವೆಂಟ್ ಟು ದ ಸಿಂಗಪೂರ್ ಸರ್. ಐ ಹ್ಯಾವ್ ಪಾಸ್ಡ್ in front of the Gleneagles Hospital. My family members used to tell, ನನ್ನ ಇನ್ಸ್ಟಿಟ್ಯೂಟ್ ಪಕ್ಕದಲ್ಲೇ Gleneagles ಇರೋದು ಅಲ್ಲಿ. They told Indian hospital in Singapore. I felt proud that the terminology they used, Indian hospital in Singapore. I used to tell Singapore hospital in India, but they told Indian hospital in Singapore. It's a great, such kind of ಭಾಳ ಖುಷಿ ಆಯಿತು. Gleneagles ಒಳ್ಳೆಯದಾಗಬೇಕು ಆ್ಯಂಡ್ ನಿಮ್ಮೆಲ್ಲ ಟೀಮ್ಗೆ ಒಳ್ಳೆಯದಾಗಲಿ. ದಿನೇಶ್ ಸರ್ನ ನಾನು ರಿಕ್ವೆಸ್ಟ್ ಮಾಡಿದೆ, ಸರ್ ಅವರೆಲ್ಲೂ ಹೋಗದೆ ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಬಂದಿದ್ದಾರೆ ಆ್ಯಂಡ್ ಕರ್ನಾಟಕದಲ್ಲಿ one of the best and the finest health minister ever had in Karnataka. I can say that. Sir is so humble, so simple, and being a part of our jothe ನಾವು ಇದೀವಿ. And recently we are opening one big hospital. We open mother and child. ಅದಕ್ಕೆಲ್ಲ ಟೋಟಲ್ ಸಪೋರ್ಟ್ ಮಾಡಿ, so hard working. Thank you sir. ನೀವು ಹೆಲ್ತ್ ಮಿನಿಸ್ಟರ್ ಆಗಿರೋದು ಸರ್.
Many of the angioplasties and angiograms and other the embolisms that they treat are all, I think, due to interventional radiology, and that has really helped people, and they get recovered also very quickly with hardly any to spend time in the hospital. And so Gleneagles is a well-established brand, having various hospitals across the world, and in Bengaluru they have got 2 hospitals, one near Kingeri and one over here, and this is a smaller facility but a more focused work will be done over here. So I'm very happy that they've started this program here, and this new initiative that they've taken will definitely help a lot of people, because medical care and medical treatment is advancing on a daily basis. Every day there is some new research, every day there is some new finding, every day we find out that what was good earlier is not considered good now, and what was considered bad earlier considered good now. So it keeps changing, and so it is an ever evolving field. Or root level, like at the molecular level, at the cellular level, and that I think is going to really rapidly change, and we are seeing greater longevity, greater lifespans, and better health spans. So people are able to live longer. Earlier, when certain things used to happen, there was hardly any cure. You could not do anything. Now there's a way out. So people are living longer, and people are living healthier also. So that I think is what is changing. And so these facilities, if it's available to you at the nearest possible facility, sometimes distance also makes it a problem. So if you can come quickly, get yourself treated and go out quickly, that I think helps a lot. And I think over here, being in Richmond town, it's in the heart of Bengaluru, and for all the people who are staying here close by, I think this will become an easy place to access and get yourself treated and then leave and go back to your homes. So I want to congratulate Gleneagles for this, what they've started, and I'm sure that they won't stop at 2 hospitals in Bengaluru, many more hospitals in Bengaluru and across Karnataka. So any support, any help that you need from us,
you can benefit more patients. A good example is, if you have a liver tumor, you will say, okay, it's a big tumor, is operated ಮಾಡಕ್ಕಾಗಲ್ಲ ಅಂತ ಹೇಳ್ತೀವಿ. But if it's interventional radiologist, they will extend the surgical field, because even if they're bleeding, interventional radiologists will put on bleeding in the spot. Why is body allowed? We can't hide behind it. We have to adopt technology and use it to our benefit. Similarly, interventional radiology is actually, in a way, when you get to graduation, the most subscribed specialty is interventional radiology. And it so happens the highest earning potential also in the US. Yes. In fact, it becomes a. At the end of the India, people only know medicine and surgery. Interventional radiology. So we have 16 years we've been going on to create awareness. But today we have reached a big day. In fact, when I came in 2008, Mangalore Bandiru, important facility like this, we have all the backup. We have a full-fledged NSCD team, ICU team, and all the support structure. So in a way, essentially it's a daycare procedure. Now in the radial artery in the MRTV, let's say we put a catheter, so we go into the artery and we find the artery into the prosthetic artery. And like another doubt is there, where the CT scan is not good. Catheter one treatment prostate artery embolization. So anybody with the neuroradiologist can do. So pretty much a heart attack or a stroke, and or a hybrid where they can actually do an operation theatre also. So that's the hybrid version. This is better in the sense because the framework will move. One of the walls. Yeah, this is obviously protected for the lab requirement. So, I'm Dr. M.C. Uttappa. I'm the Director of Interventional Radiology. Today we are at Gleneagles Hospital in Richmond Road. We have a great pleasure in inaugurating a new facility, a new department at Gleneagles Hospital in Richmond Road. It is in the city center of Bangalore. As some of you may be aware, that interventional radiology has come a long way. But today we are creating a new entity. It's almost like a new baby, where an interventional radiology will be delivered in a facility which has got a full team of our own colleagues, which we got Dr. Bhavya here, Dr. Rohit, and somebody to help us in making sure that we're doing everything right. We have Dr. Jatinder Arora. So today we have got together to inaugurate a facility. It is a state-of-the-art facility. We always say that patients have to travel to different countries to receive world-class treatment. Today we can proudly say that we have a world-class facility right in Richmond Road. We have all the technology, ultrasound, CT, and a state-of-the-art lab wherein we can do all procedures. With this machine which we have in the background, we can do head-to-toe every procedure which is minimally invasive. So minimally invasive meaning that you don't need to do open surgery. Many of the time we don't need to use general anesthesia for this. So a lot of the time these patients can go home the same day. Essentially every part of the body without open surgery we are able to treat these patients. We also are starting up a new service dedicated to women, and I'll request Dr. Bhavya to say a few words on that.
I come across patients who have lumps in the breasts most often, and most of them are not willing to undergo surgery. Definitely no woman would want to have a scar on a breast, and we can avoid that. We can very well avoid that by doing pinhole surgeries. It's a very minimal invasive surgery wherein we put a needle and we try to clear up the lump, and we are providing that service here. Whoever is having issues with the breast lump can visit us and do a in-detail consultation, and we will be able to help them out.
What is the success rate?
Success rate is almost as equal to surgery. So, and in fact, if I have to weigh it against surgery, it is much more. It's better than surgery, I can say, because it's a daycare procedure. So, patient recovery will be very faster, and post-operative pain and all those complications will be far less when compared to surgery.
What is the cost?
So cost, so it depends again. So which modality we are using. So we have various options here. We have vacuum assisted excision, we have cryotherapy. So cost varies from procedure to procedure.
Thank you.
Thank you.
So I'll explain, like Gleneagles Hospital is having this new department of Gleneagles Institute of Radiological Intervention. It is much needed in this era, when people are avoiding these big scars and the big incisions on their body. So interventional radiology is a branch where you can avoid these things through a very small incision, or by puncturing the skin. You can have an access to the various vital organs through the major blood vessels, and you can treat the vascular, non-vascular tumors, and the other ailments of the body. Thank you.
Rohit Srinivas, consultant intervention radiologist ಗ್ಲೆನಿಗಲ್ ಹಾಸ್ಪಿಟಲ್ ರಿಚ್ಮಂಡ್ ರೋಡ್ ಗ್ಲೆನಿಗಲ್ಸ್ ಇಂಟರ್ವೆನ್ಷನ್ ರೇಡಿಯಾಲಜಿ ಇನ್ಸ್ಟಿಟ್ಯೂಟಲ್ಲಿ. ಇವತ್ತೊಂದು ಚಿಕ್ಕದಾಗಿ ನಾವು ವ್ಯಾರಿಕೋಸ್ ವೇನ್ ಅಂದರೆ ಏನು ಅಂತ ತಿಳ್ಕೊಳ್ಳೋಣ. ಯಾವಾಗ ಕಾಲಿನ ರಕ್ತನಾಳಗಳು ಉಬ್ಬಿ ಗಂಟಾಗಿ ಕಾಣಿಸುತ್ತೆ ಅದು ವ್ಯಾರಿಕೋಸ್ ವೇನ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಹಿಂದಿನ ಕಾಲದಲ್ಲೆಲ್ಲ ವ್ಯಾರಿಕೋಸ್ ವೇನ್ ಅಂದರೆ ಏನೋ ದೊಡ್ಡ ಸರ್ಜರಿ, ಹತ್ರ 3 ಇಂದ 4 ಇಂಚ್ ಇನ್ಸಿಷನ್ ಮಾಡಿ ಆ ಪೂರ್ತಿ ರಕ್ತನಾಳನ ತೆಗಿಯೋರು ಹೊರಗೆ. ಅದೊಂದು ಮೇಜರ್ ಸರ್ಜರಿ. ಅಷ್ಟೆಲ್ಲ ಮಾಡಿದ್ರೂ ಚಾನ್ಸಸ್ ಆಫ್ ರಿಕರೆನ್ಸ್ ಅಂದರೆ ಮತ್ತೆ ಬರೋವಂಥ ಸಾಧ್ಯತೆ ಇರೋದು. ಈಗ ನಾವೇನು ಮಾಡ್ತೀವಿ, ಹಾರ್ಡ್ಲಿ 2 ರಿಂದ 3 ಮಿಲಿಮೀಟರ್, ನಾಟ್ ಇವನ್ ಮಿಲಿಮೀಟರ್ ಅಷ್ಟು ಚಿಕ್ಕದೊಂದು ಹೋಲ್ ಮಾಡಿ ಆ ರಕ್ತನಾಳದ ಒಳಗಡೆ ಹೋಗಿ ಅದೇನು ರಕ್ತನಾಳ ಡ್ಯಾಮೇಜ್ ಆಗಿರುತ್ತಲ್ಲ ಅದನ್ನು ಇದರ್ ಲೇಸರ್, ರೇಡಿಯೋ ಫ್ರೀಕ್ವೆನ್ಸಿ ಅಥವಾ ಮೈಕ್ರೋವೇವಿಂದ ಯೂಸ್ ಮಾಡಿ ಆ ರಕ್ತನಾಳನ ಆಲ್ಮೋಸ್ಟ್ ಡಿಸ್ಟ್ರಾಯ್ ಮಾಡಿಬಿಡ್ತೀವಿ. ಇನ್ನೊಂದು ಹೊಸ ಟ್ರೀಟ್ಮೆಂಟ್ ಏನಂದರೆ ಗಮ್ ಅಂತ ಏನು ಬರುತ್ತಲ್ಲ ನಾವು ಇದು ಮಾಡ್ತೀವಲ್ಲ, ಅದೇ ರೀತಿ ಆ ರಕ್ತನಾಳನ್ನು ಕಂಪ್ರೆಸ್ ಮಾಡ್ತೀವಿ, ತೆಗಿತೀವಿ. ಸೊ ಇದರಲ್ಲಿ ದೊಡ್ಡ ಕಟ್ಟಾಗಲಿ ಹೊಲಿಗೆ ಹಾಕೋದಾಗಲಿ ಯಾವುದೂ ಇರೋದಿಲ್ಲ, ಏನೂ ಕಾಣೋದಿಲ್ಲ. ಪೇಷಂಟ್ ಬೆಳಗ್ಗೆ ಬಂದರೆ ಸಂಜೆ ಅಷ್ಟೊತ್ತಿಗೆ ಡಿಸ್ಚಾರ್ಜ್ ಮಾಡಿ ಕಳಿಸ್ಕೊಡ್ತೀವಿ. ಪ್ರೊಸೀಜರು ಲೋಕಲ್ ಅನಸ್ತೀಷದಲ್ಲೇ ಮಾಡ್ತೀವಿ, ಯಾವುದೇ ರೀತಿಯಾದ ಜನರಲ್ ಅನಸ್ತೀಷದ ಅವಶ್ಯಕತೆ ಬರೋದಿಲ್ಲ. ಸಿನ್ಸ್ ಬೆಳಗ್ಗೆ ಬಂದು ಸಂಜೆ ಕಳಿಸ್ಕೊಡೋದ್ರಿಂದ ಅವ್ರಿಗೆ ಪೇಯ್ನೂ ಕಮ್ಮಿ ಇರುತ್ತೆ, ರಿಕವರಿ ಫಾಸ್ಟಾಗಿರುತ್ತೆ. ಬೆಳಗ್ಗೆ ಬಂದು ಪ್ರೊಸೀಜರ್ ಮಾಡಿ ಹೋಗಿ ಸಂಜೆ ಹೋದರೆ ಮತ್ತೆ ಮಾರನೇ ದಿನ ಅವ್ರು ಅವ್ರ ಕೆಲಸಕ್ಕೆ ವಾಪಸ್ ಹೋಗ್ಬೋದು. ಸೊ ರಿಕವರಿ ಅಷ್ಟು ಫಾಸ್ಟ್ ಇರುತ್ತೆ. ಸೊ ಇದು ಚಿಕ್ಕದೊಂದು ತುಣುಕು ವ್ಯಾರಿಕೋಸ್ ವೇನ್ಸ್ ಬಗ್ಗೆ. ಅಡ್ವಾಂಟೇಜ್ ಇದು ವರ್ಲ್ಡ್ ಕ್ಲಾಸ್ ಫೆಸಿಲಿಟಿ, ಇಡೀ ವರ್ಲ್ಡಲ್ಲಿ ಮೋಸ್ಟ್ ಅಡ್ವಾನ್ಸ್ ಟೆಕ್ನಾಲಜಿ ನಾನು ಹೇಳ್ತಿರೋ ಅಂಥದ್ದು. ನಾನು ಹೇಳ್ದಂಗೆ ಕಟ್ ಅಥವಾ ಇದಿರೋದಿಲ್ಲ, ಹೊಲಿಗೆ ಹಾಕುವಂಥದ್ದು ಇರೋದಿಲ್ಲ, ಸೇಮ್ ಡೇ ಡಿಸ್ಚಾರ್ಜ್ ಮಾಡ್ಬೋದು, ಪೇಯ್ನ್ ಕಮ್ಮಿ ಇರುತ್ತೆ, ಸ್ಕಾರ್ ಇರೋದಿಲ್ಲ. ಇದು ಅಷ್ಟೆಲ್ಲ ಲಿಟ್ರಲಿ ಒನ್ ಇಂಜೆಕ್ಷನ್ ಅಂತಲೇ ಹೇಳ್ಬೋದು ನೀವು. ಇದೆಲ್ಲನೂ ಅಡ್ವಾಂಟೇಜಸ್. ಡಿಸ್ಅಡ್ವಾಂಟೇಜಸ್ ನೋಡಿದರೆ ಸರ್ಜರಿ ಅಥವಾ ಇದಕ್ಕೆ ಕಂಪೇರ್ ಮಾಡಿದ್ರೆ ಇದಕ್ಕೆ ಯಾವುದೇ ರೀತಿಯಾದಂಥದ್ದು ಮೇಜರ್ ಡಿಸ್ಅಡ್ವಾಂಟೇಜಸ್ ಇರೋದಿಲ್ಲ. ಕಾಂಪ್ಲಿಕೇಶನ್ ರೇಟ್ಸ್ ನೀವು ಯಾವುದೇ ಪ್ರೊಸೀಜರ್ ತೊಗೊಂಡು ಲೆಸ್ ದೆನ್ 1% ಅಷ್ಟು ಕಾಂಪ್ಲಿಕೇಶನ್ ರೇಟ್ಸ್ ಇರುತ್ತೆ. ಬಟ್ ಇಟ್ ಈಸ್ ವೆರಿ ವೆರಿ ಮಿನಿಮಲ್. ಥ್ಯಾಂಕ್ ಯು.